All right, so we're back with Dr. Elissa Cohen, and she's here to talk to us about dry needling. So what is dry needling?
So dry needling uses these small little filament needles, and it goes into the muscle belly to help release muscle tone faster. So a lot of people think they're like, oh, I've had acupuncture before, I know what that feels like. It's different than acupuncture in that, generally speaking, acupuncturists are kind of looking for meridians and energy flow in the body like chi, and they're trying to release that and make that flow better. I am just finding a tight muscle and putting a needle in it, just like I would with my hands. If I find tight muscles, I do trigger point release to release that. This is just a faster way to release muscle tension. I use it a lot because I find it super effective and it makes the muscle tension go away a lot faster. And also, we don't have to use it in the clinic. If you are scared of needles and you're like, oh my God, that sounds terrible, manual therapy is gonna work as well, but I do think that dry needling is so much more quick and effective.
So what type of conditions would you see women presenting with when you would use this type of therapy?
We can treat most muscles in the body. So like anywhere that you have a tight muscle, this can be effective, but I treat a lot on the back side of the pelvis. So like the glutes and the piriformis and things like that relative to low back pain, SI pain. We can like work through the low back muscles there. We can treat anywhere along the spine. So sometimes I'll treat here to address urinary urgency. We can treat through upper traps, the chest, up into the neck, the suboccipital area, things like that, to address tension, headaches, issues with nursing, things like that. We can work through the front of the pelvis, so like hip flexors and quads and that sort of thing if you're having hip pain or tightness postpartum.
And what is this you're putting into the needle now?
So I place needles in the muscles in the tight spots, and so now we use electrical stimulation with it. So we're basically making the muscle twitch in a rhythmic way. You can see this one's twitching pretty well. When we get that twitching, it helps the muscle reset. So electricity is the language of the muscle. That's how the muscle receives input. And so we can put electricity into the muscle. It helps reset that muscle tone and says, if the muscle's too tight, it's going to make it get looser and calm down a lot. If it's weak and not firing very well, then it's going to help it come on board a little bit faster and be active like we want it to be. And then we usually just let it sit here and we can let those muscles relax and reset.
Very incredible. And so like you said, there's a lot of different other areas of the body we can work and utilize this type of therapy.
Yeah, I say this truthfully, even though it's hard to understand, but pretty much anywhere you have a muscle, we can use a needle to loosen it up faster. And so if there's tight muscles that are contributing to a condition, this is going to be effective. It's not going to be the only part of the treatment. We need to get the muscles loosened and going through their full range of motion. And then we also have to strengthen to reinforce what we're trying to accomplish. So this is the range of motion muscle loosening portion of things, and then you're going to do some strengthening or postural work in addition to that.
Fantastic. Thank you so much.
Yeah.
Now we're just removing the needles.